Kick us off tonight, this afternoon. I'm okay. I'm all right, you guys. Don't worry. I'm fine. This afternoon with our Enhanced Care Management panel, Promises and Practices. So we'll get started with that. Go ahead.
Hello, I'm Ann Coons. I'm the president and CEO of the California Children's Hospital Association. And, oh, thanks. I hardly ever get that. I'm flattered. And with me today are our two great panelists, Kashaw King, who I think spoke earlier, and Dr. Mona Patel, who is at CHLA and whose department oversees enhanced care management at Children's Hospital Los Angeles. I'm going to try really hard not to use any acronyms today. Before we get started, I wanted to make this we wanted to make this conversational. So I'm just going to prepare, I have a few slides I'm going to talk to, just kind of explaining what enhanced care management is, if you're not familiar with it, who it's designed for, and then we'll kind of have a conversation about how we think it's working. So enhanced care management is intensive care coordination services that span multiple delivery systems through a person-centered approach to care. And it was created through, originally through CalAIM, California, I can't remember what it stands for, it's another acronym, Advancing, yes, I think that's right. Thank you, Mayor Morton. Californians Innovating Advancements in Medi-Cal. We'll go with that. And as part of that overhaul, which is something that the Department of Healthcare Services undertook about 5 or 6 years ago, they added this benefit, enhanced care management, and it's really supposed to not just be like another case manager on top of all the other case managers. It's really supposed to be for a intensive person-centered approach. And they sort of staggered how they were going to enroll people in this benefit, and they started enrolling children and youth in July of 2023. And that's when this benefit came available for that population, what they're calling the population of focus. And so this is supposed to be for people, it's designed to address both clinical and non-clinical needs for the highest needs Medi-Cal populations through intensive coordination. And it's supposed to be delivered in person, meeting patients wherever they are, on the street, in a shelter, at their homes. So it really is designed to be a different kind of benefit than what we've seen in other types of programs when we look at care management. So the components of enhanced care management include outreach and engagement, comprehensive assessment and care management plans, enhanced care coordination across delivery systems, health promotion, comprehensive transitional care from one program to another, member and family supports, and coordination of and referral to community and social service support services. I want to wait, somebody was taking a picture there. So, and then for the children and youth population of focus, the populations that enhanced care management is focused on are families and children experiencing homelessness, kids who are at risk for avoidable hospitalization or emergency department use, children and youth who have serious mental health or substance use disorder needs, children and youth transitioning from incarceration, children who are enrolled in the California Children's Services Program, child welfare or foster youth, and populations at risk for adverse birth outcomes because of socioeconomic or racial factors. So that's kind of the overall just kind of summary of what is ECM. So now that we've kind of gone through just the basics, I'm going to start by asking Kashaw and Mona maybe one at a time. Wait, I have to get my questions. Okay. I thought I'd start first by asking each of you a little bit about what kinds of work your organization does with respect to enhanced care management. And we'll start with you, Kashaw. Pick up a microphone.
Hello.
Sorry about that. There we go. Okay, there we go. Sorry about that. I work for Family Resource Navigators. We are located in Alameda County, so we serve all of Alameda County. And We are part of the Family Resource Centers of California. And our ECM program looks a little bit different because we come from the lens of being parents ourselves. And so it looks a little bit different than a clinical lens. And in our program, we're able to help families not only navigate the systems, the healthcare systems, but we're also able to help them navigate other systems like Regional Center, California Children's Services, IHSS, SSI, and I know that part of that is ECM. However, in the work that we do, we relate more with the families from a person-centered model of care, and we're able to better connect with families because we are those families, and so we're better able to help them navigate those systems. So we incorporate the work we do on a daily basis with the enhanced case management part of the work, the highest need, those with the highest need. And so in our program, it's been hard for a lot of families. One, families don't really understand what ECM is. They don't understand how it can help them, how it can support them. And we're talking about the most vulnerable in areas in which families like the ones we serve typically have trust issues. They have trust issues with systems where you have a case manager or a social worker, and so it's very difficult, even in the lens we come from, to connect with families. So it's not been really easy for us to connect with families in a way we're able to help them in the way that they need. And although it's been difficult, we've been able to explain to them in a way in which they understand because of the connection of who we are. And I'll let Mona add hers, and then I'll go into some other stuff, but that's the lens we come from.
Sure. So good afternoon, everyone. So I have the privilege of working at Children's Hospital Los Angeles. I'm a practicing pediatrician, been proudly and humbly serving our children with special health care needs for the past couple decades now. I work in our embedded FQHC and do outpatient care, and I also practice as a hospitalist and inpatient. So for me, it's continuum of care coordination within our hospital systems, and then also transition of care back to the community. And this is the model that we've embedded when it comes to enhanced care management. We started our program in spring of 2023. We contracted a Class 7 managed care plans in 3 counties. We started with a staff of 10 community health workers, and this is the first time we brought community health work staff onto staff at CHLA, and I'm proud that almost 3 years later, we're up to 18 FTE community health workforce. We are contracted for the CCS population of focus, the welfare involved population of focus, this year's mental health illness, substance use disorder, and birth equity populations of focus. So our model really has been where we have infrastructure built in our complex environment in healthcare. How do we sort of break that down and bring the community inside to build trust? And it's really been a bi-directional move, as I can say as a physician. I think medicine is old school, and I think we know that health-related social needs, when we think about things like food, housing, transportation, utilities, many times those factors are just as important, if not more important, than the medicines I may prescribe as a doctor, and how that impacts the outcomes of our children and youth. And how important that is to bring that to the table when we're doing our care conferences, and bringing that value into the discussion matters so, so much. At my organization, we're 75% Medi-Cal serving as a safety net hospital in LA County, and we have a lot of delegated payer environments, a lot of managed care. So on top of our children and families having challenges, you think about insurance and disenrollments that happen, it's quite complicated, let alone having health-related social needs of 30% for my organization of having at least one factor. So this is the program that we've built over time with our enhanced care management lens. In almost 3 years, we've served about 1,650 patients and families with our program, and this year we're looking to expand in building out our pediatric collaboration in food and asthma with our community-based organizations.
If I could, I wanted to just maybe expand a little bit on something you said, Mona, and just so people understand. The benefit is actually offered through Medi-Cal managed care plans. And then, so any provider who wants to serve this population, anybody who wants to be an enhanced care management provider has to contract with the managed care plans. So what Mona is referring to is sometimes that require in a big county like LA, you have to, any enhanced care management, anybody who's providing that service needs to contract kind of with multiple managed care plans if they want to serve that population. So I just wanted to add that question. Did you, or just add that, elaborate a little bit? Yeah.
Hello, go ahead now. Okay. I just want to add, I forgot to say who, so we serve both Alameda and Contra Costa counties in our ECM program, and we're contracted with Full Circle, and we work with Kaiser, Alameda Alliance, and Contra Costa Health Plan for our ECM program. And we do case management. Also with CCS, we do case management like once a month. So the ECM programs in our areas, we come together and talk about. Sometimes we get a referral or they get a referral and they go, oh, that's a better fit for the family, so that they are connected to the right program in order to get their enhanced case management services.
So one of the questions I wanted to ask both of you is, I think there's sometimes confusion. I know that I was originally kind of confused about this even when it started. What's the difference between, like CCS case management and enhanced care, I think you might think like the last thing I need is like one more case manager. Can you kind of explain a little bit, maybe through an example of like a child that would be a good fit for enhanced care management versus maybe like how that would be different from just typical care management that say they might get from CCS? Like what are the kinds of services, what are the kinds of kids? I'll start with Mona maybe? Yep.
Sure. So as I mentioned, we launched our screening that we've been doing with our population, asking formidable questions about food, housing, transportation, access to utilities, behavioral mental health service needs, on top of thinking about our children and youth with special health care needs. So I was auditing some charts last week, and I was reviewing one of a 13-year-old boy with spina bifida who's cared for in our CCS Special Care Center for spina bifida. And the family reported health-related social need factors positive, where they were behind on utility bills, electric and internet. And they had challenges with transportation, recent disruption to their MTU services, and navigating a challenging IEP at school, right? If we think about our CCS core teams, right, in our clinic systems, at least I know at my hospital, I don't have enough staffing, enough social work support, enough RN care management support, enough behavioral mental health support that can really, truly walk alongside my patients and families to help the gravity of all of those different things. The family is monolingual Spanish speaking. The transportation can be provided through their LA Care Medi-Cal managed care plan. So month over month, the family has to call managed care, has to work with the school system with the IEP, right? has to traverse, and you can apply for low-income waivers with our LADWP, that's our local, utility provider. But what Christian did, he's our community health worker that's embedded within Spina Bifida, he stays on the phone for hours with the family. He wrote the letter in Spanish with the father for the utility company. He goes to the IEP meetings at the school and advocates with the family. He, every single month, calls with the mom and the managed care companies and Access to ensure that the rides are always there. He gets the address for Gardena MTU and makes sure that the PT and the OT and all the therapies are in place. So it's really high touch, different level of care, walking alongside the families and not placing all of the burden on top of our families to have to navigate. But it's a different lens of that perspective, because I think that our core teams are already so overburdened with the volumes of the approach that they have to provide.
And I mean, Mona, you described basically what we do at our organization. I think one of the most important things for us, and really detailed, is that risk assessment, because that's where it starts. So that's where you're really asking the family what the need is, rather than saying, this is what you need. You're asking the family, what is it that you need? So doing that risk assessment sets the tone for how you're going to be able to support those families. And so I want to quickly just talk about a case we had, and this one is a grandmother who is caring for a child who's quadriplegic, a 19-year-old who's quadriplegic, has cerebral palsy and cortical visual impairment. And I'll just say, I like to think of ECM in some ways, particularly for those who are young adults, as an extension of CCS. That's how I view it, because there is no in-between. And so basically, the grandmother is the legal guardian, and our lead case manager came from the approach of a parent-centered approach, sitting down. It takes hours. Our ECM lead works 40 hours a week, and sometimes she's working on the weekend to make sure she is capturing everything. She's making all the phone calls to make sure that everything is covered for the family and that the family needs are being met. There are unmet needs that they had before they came to us or were referred to us. And again, these are high-touch families that we are supporting, and getting things like increased respite hours for a family. And I know that it looks like, well, that's what family resource centers do. But again, across the board, like we've had an increase in foster children as a result of our ECM program. So children we weren't touching before. And so that has changed, the work that we do, or enhanced the work that we do beyond us already navigating all of those systems, but we've delved into a different space now for us. So it's all essentially new for us as well, because you have some red tape in there that you have to get through. And so I just want to say that, working on, as Mona said, IEPs and individual program plans, we were able to get this particular child an increase. Our lead case manager was able to get a family 300 hours of respite. 300 hours of respite. That is huge, and it was not easy. So it's very intensive work. And I think that's the difference in the CCS piece of it, is that it's very intense work. And the loads you know, you guys have a lot. I have one staff right now. And we really just started our ECM program in August of last year. But we have 20 families we're supporting now, and that's one lead case manager who's supporting those families.
Thank you for that. Can you talk a little bit about what the biggest challenges you've experienced with enhanced case management are, either from your organization's perspective, from the family's perspective? What are some of the things that are kind of barriers to better operation of the program or more uptake?
I think administering the program from the state down to the many managed care plans and how different each plan then administers it, and the different audits amongst all of the different plans is really challenging. The many different contract amendments, the changes that happen over and over again. I think for one of the health plans, we're on our 8th contract amendment starting in 2 weeks. So then with that is every single time you're training, retraining, new perspectives, new ways of delivering the care. I think the age-old pediatric patients are not little adults because everything keeps trickling down that adult readmission scores, adult chronic disease elements, adult kind of parameters are set, and we always have to advocate and say this is not the same things that you should be looking at. So that's another perspective that can be frustrating. And those are just two of the big.
And then for us, some of the common challenges we've had, again, going back to families not really understanding ECM, is difficulty engaging members, because for them it's like it's another program. So I think, you know, with the families that we have been able to engage, it's really, you know, helped them to really understand it more. But again, that has been difficult, particularly early on. And then high no-show rates. Again, I talked about how you have families have so much going on. It's like some of these things are just not on their radar, or, you know, another meeting for them to have to come to until they really understand how ECM can support them. And then we get a lot of housing instability. And one of the challenges to that is it's across the board. Everyone is using the same resources. There are no new resources out there, in particular for housing. There are no other resources out there. So everyone's using that same pool for housing. And then co-occurring mental health and substance use, right? You know, how to navigate that, how to get the supports there for that. And then just the systems fragmentation. You talked about that. You know, those are the challenges that we're facing.
I have more questions, but I want to leave time for the audience, and I know we've got about 6 minutes. I see that over there. Yeah.
Okay, so my question is, as a parent, so we hear about the program, like it, love it, definitely feel like it could fill holes and assist us, but I'm confused as far as the starting point. I know you say you guys, the big umbrella is the Family Resource Center of California, but then it's administered by different organizations per county. So if, like, today I wanted to call someone and say, heard about an ECM, I want to get one for my kids, where do I go? Who do I talk to? What do I need to say?
So not every Family Resource Center has an ECM program. So that's number one. And you said you're in LA County. I'm not sure if they have one, but Mona can talk to you. I'm not from LA, but I just want to say that although we are, as family resource navigators, are under the umbrella of the Family Resource Centers of California, not every family resource center is contracted to have a ECM program.
I think the easiest way, as was mentioned, is this benefit is delivered through Medi-Cal Managed Care. So if you call and find out who the ECM contracted providers are with your plan, then you'll be able to reach out and request. And the confusing and hard thing is that they'll be able to tell you who is contracted for CCS, who is contracted for the welfare involved population, and then you can go from there. Yes. So you can call your health plan, your Medi-Cal Managed Care plan, and find out who the contracted ECM providers are.
Yeah,
That's where I would start.
Yeah, you can say, my child is, give them some indication of your child's kind of where in the population of focus, if they're CCS or, have a mental health issue. You tell them something about your child, and then you say, I want to find an enhanced care management program that will serve my child, and they should be able to tell you and refer you to somebody who is providing that service in your county, under your plan's contract. Yeah. So woman in the green dress and then woman in the beige sweater? Is that?
We've got a couple questions on Zoom as well.
Oh, okay.
Yes.
Hi, everybody. My name is Lisa Hooks. I'm with this. When it comes to the enhanced managed care, it is offered through Medi-Cal or Medicaid services for everyone who's receiving that. You would go to the Department of Healthcare Services, look on their website, or you can go to CalAIM. You can pull up enhanced managed care, or better yet, you can come to my table in the back. Can I see this young lady here? And you can look for this sheet. This will tell you that they offer 14 services. Not all enhanced managed care will offer the same 14 services, but in most metropolitan areas, they do. You would then look this service up when you do an intake for enhanced managed care services. They would talk to you and talk about your needs. It's kind of the same concept as FAPE, free and appropriate public education. If your child is school age and their disability impacts their ability to be educated, you're supposed to be talking about that for an IEP. With enhanced managed care, if the child's disability or the services that you need as a family is impacting your ability to maintain your health, then you need to be talking about enhanced managed care. I just wanted to add that. Come and see me in the back, but yes, it is available for everyone who has a managed care plan.
All right, we got one over here, then we're going to go over to Zoom. We're going to do this all quickly.
Hi guys, my name's Courtney and my daughter was recently diagnosed with pinocytoma, which is a rare brain tumor. The biggest barrier that I am currently facing is not everybody is equipped for a diagnosis like my daughter's, and there's a lot of barriers where the response I'm getting is we're just not equipped for that type of diagnosis. What would you say to other families that have situations like ours?
So are you talking about for ECM? Oh, rural, oh.
Do you have Lake Family Resource Center, which has been a wonderful bridge
Yes.
and great for us. However, that is just one out of many different things
Barriers,
that
yeah.
barriers.
Yeah.
Being that actually we are leaving here and we go straight to UCSF for our next round of MRIs, we're just facing a lot of barriers just in terms
Yeah.
of access to care, access to calendars that work for everybody, and then being that we're so rural, we're just kind of facing some statistical and logistical issues. With other families like mine, what would you guys how would you provide guidance to kind of start those processes for people in my situation?
That's a question beyond ECM. I'm happy to talk to you offline about that. I think that kind of goes into barriers for just the system as a whole. So I'm happy to connect with you after.
I'm also wondering whether or not you might try, if you've asked UCSF, if they have, some special care centers, for example, at children's hospitals have ECM embedded in the special care center. And you might see if they do that, they might have to do a one-off contract with your rural managed care plan or whatever, but there might be a way to do it that way, and they might still be able to help you with some of the managing some of the logistics, and just see if that's an option for you.
UCSF does have that.
Yeah, they do have that.
Yes, it's called the Care Coordination Program, CCP. It's Enhanced Care Management through UCSF.
You can also see me, Nancy at Family Voices. We're working on rural in the same situation. Happy to help you.
Yeah, rural
All right.
is the whole.
Do we have time for any of the Zoom questions, too?
So, first question, my experience with referring CCS and foster care clients to ECM in San Francisco has been very different from what is described, much less intensive, much less helpful. Are your programs funded differently than other ECM providers in the community to provide this level of intensive care management?
So this is the challenge with ECM benefit and CCS and welfare-involved populations, and the straight Medi-Cal and population of welfare-involved and what is likely not carved into Medi-Cal managed care. So we have actually been leveraging a different benefit called CHW benefit at our hospital to
Community
be able
health
to toggle,
workers, yeah.
to be able to toggle a kind of exactly the same type of program, because it is challenging. While it is a population of focus for welfare involved, it's not the same distribution of reimbursement for enhanced care management, but we figured out a different way to serve.
I would also say, and this has been an issue for us as children's hospitals, is that sometimes managed care plans will contract with sort of generalists for enhanced care management, and then they refer all patients to those generalists, and they may not actually have a lot of experience with children with complex needs, and so they're not the right person really to connect with. So that can be a problem too. It's a very distributed model, and so you definitely experience like the ups and downs of that in terms of like kind of quality control, I would say.
All right, we got one more we can fit in from Zoom over here. How long do ECM case managers keep cases open with clients? Is it long-term case management?
Hello? For us, it's about a year. We will support them. We can actually, because we are a family resource center, we can actually help them much longer, like life, for instance, because we are a family resource center. We're able to embed that work in our ECM work, or embed the ECM work into the work that we do.
Same, you have to get a repeat authorization, and everything is based on the goals that you collaborate with your patients and families. It really depends on what the needs are. We usually cycle 6 to 8 months, and then we do have moments where we will re-enroll again if there's a changing need. Our averages do typically run about 10 to 12 months, though, for our families.
All right, well, sorry to go a little bit over, but thank you, panelists, for a great conversation.